Hi, guys. Welcome back to Health Decoded, the podcast where we break down health and the human body in a way that actually makes sense. I'm Alex, I'm your nurse, and today we're talking about blood sugar, specifically how to recognize the signs of low blood sugar versus high blood sugar. Blood sugar is something that we do hear a lot about, but many people don't really understand what it is or what's normal or how the body responds to it and the differences between when it's low and when it's high. So, today we're going to walk through the anatomy and the physiology behind blood sugar regulation and give you practical ways to recognize the signs of hypoglycemia and hyperglycemia. So, the big picture, what is blood sugar? Blood sugar is also called blood glucose. So, I will use those two synonymously. And that's the amount of sugar that circulates in your bloodstream. Blood glucose, or rather glucose, is the body's main source of energy, especially for the brain and the muscles. Most of our glucose comes from carbohydrates from food. After digestion, glucose enters the bloodstream, and the body has to move it into the cells where it can actually be used for energy. This process is tightly regulated because too little, but also too much, can cause problems. So, our target levels roughly are going to be we'll have fasting and then non fasting. So, fasting is without food or before a meal, and then fasting is after you've eaten. So, before a meal, ideally the range would be 80 to 130 milligrams per deciliter. So, this would be if you went and checked your blood glucose on a little machine, it would pop up, it would say 90, and you're good to go. So 2 hours after the meal, the range would be less than 180 ideally. When you talk about diabetes and all of those types of diseases, we're not really getting into that today. We're just getting into signs and symptoms of low and high blood sugar. The levels are going to look a little bit different, but that's just a reference range for you to understand as we're talking about low and high. It would help if I could talk. Okay, anatomy. Several organs work together to regulate the blood sugar. We'll start with the pancreas. So, the pancreas is the main control center for blood sugar. Inside it are tiny clusters of cells. I'm not going to bog you down with a whole ton of names and terminology, but we have beta cells and alpha cells. So, beta cells release insulin, which helps move sugar from the bloodstream and into the cells to be used for energy or to be stored to be used for later. Alpha cells release glucagon, which does the opposite. So it raises the blood sugar when it drops too low so that we actually have energy to use. Next, we'll move into the liver. The liver acts as a glucose storage warehouse. So after you eat, it stores the extra sugar in a form of glucose called glycogen. So when blood sugar drops, like between meals or overnight or during exercise, the liver releases glucose back into the bloodstream to help keep your levels steady so that you actually have something to use as you're doing these things. This is especially important for preventing low blood sugar. We also have muscle and fat cells that come into play for this. So these cells respond to insulin by pulling glucose out of the blood. The muscle cells will use it for movement and activity, like we talked about, and then the fat cells store it for energy use for later. If insulin isn't working well, glucose stays in the bloodstream instead of getting into these cells, which can then lead to high blood sugar. We'll also talk about the brain. The brain plays a huge role, almost as always. Your brain depends almost entirely on glucose for fuel. It doesn't have a good backup source for energy. That's why symptoms of low blood sugar often affect your thinking, your mood, your alertness. So we'll get into some of the symptoms, but things like confusion or irritability come when we have low levels of blood sugar. The brain is constantly monitoring for blood sugar. It's sending out signals and warning signs when these levels drop. And so, for instance, talking about like the irritability I was talking about, let's say you go on a low carb diet, or like people will talk about the keto flu. This is why these symptoms exist. You're reducing your blood sugar intake, therefore, your brain has less carbs with which to work from. So, you get these other symptoms, such as decreased mentation or irritability or sleepiness, things like that. There's also your gut. We're still in the anatomy. After you eat, your gut releases hormones that help signal the pancreas to release insulin. This helps explain why the type of food that you eat, not just the amount, matters when it comes to blood sugar control. And we can also give a quick shout out to the kidneys. The kidneys help to filter excess sugar out of the blood. So when blood sugar gets too high, they try to remove excess glucose through urine so that we excrete it, which is why we'll talk about with hyperglycemia, which is high blood sugar. When somebody's experiencing frequent urination or thirst, those are common signs of having blood sugar that's too high. So, the short version. This is how it works under normal conditions. After you eat, your blood sugar rises. The pancreas releases insulin. The insulin allows the glucose to move from the bloodstream into the cells to be used for energy. Blood sugar levels can modulate, but ideally come back into normal range. So when you haven't eaten for a while and your blood sugar drops, the pancreas releases glucagon, which is the extra storages, and that signals for the liver to also release more glucose. This back and forth between insulin and glucagon can help keep your blood sugar within a safe range, which is a process we'll call homeostasis. We want homeostasis so that we can be at a baseline level and our bodies can operate normally. So getting into the differences between low and high blood sugar. Low blood sugar is hypoglycemia. So hypo means low. Hypoglycemia, so we said about 70 to 80, below that is going to be low for your ranges for blood sugar. When blood sugar drops, the brain is usually the first to notice. Common signs: shakiness, sweating, rapid heartbeat, hunger, irritability. Those are our starter signs. But as the levels drop further, the symptoms can actually include further confusion, dizziness, headache, changes in speech, particularly slurred speech, or even loss of consciousness. These symptoms happen because the brain isn't getting enough glucose in order to function properly, and it's really important that we do something about this when we start to notice these symptoms. So then the signs of hyperglycemia, so hyper is high. This often develops more slowly than hypoglycemia, so the symptoms can actually be easier to miss or maybe get confused with something else. So we talked about increased thirst, frequent urination, fatigue, blurred vision, headaches. Over time, consistently high blood sugar can actually damage blood vessels and nerves, which is why long-term management is so important. So those of you that may be listening with diabetes, when our blood sugar is uncontrolled, this is why you get a lot of the other symptoms and conditions that occur with diabetes. So diabetic retinopathy, with problems with your vision and your eyes, increased wounds, nerve damage such as neuropathy. It's because there's so much blood sugar that's circulating around in your blood. It's legitimately just eating away at these different things. So, key differences between hypo and hyper, or low and high blood sugar. A helpful way to remember the difference: low blood sugar tends to feel fast, shaky, and urgent. High blood sugar tends to feel slow, tired, and thirsty. Both are signals from the body that the balance has been disrupted and needs to be regulated. So, the guidance for what to do: low blood sugar is usually more urgent because we don't have enough for the body and particularly the brain to function. If you or someone around you has these symptoms that we talked about, shakiness, dizziness, confusion, the first step is to check your blood sugar if possible. And if you can't, treat it based on the symptoms. So if the person is awake and able to swallow, we want to get glucose in as quickly as possible. So we want to follow the 15-15 rule. So give about 15 grams of fast-acting sugar. This could be a glucose tablet if you have it, juice, regular soda, so like not the sugar-free kind, like regular soda, honey, hard candy. Find a sugar source. Wait 15 minutes after it's been given and then recheck the blood sugar if you're able, or see if the symptoms have improved. If it's still low or the symptoms have not improved, repeat. We don't want to go so many times that we jack up the blood sugar, but again, Low blood sugar is much more concerning than high blood sugar, okay? And we'll get into that. So once blood sugar comes back up, it's important to eat a small snack with protein or carbs just to help regulate and keep levels stable. So if the person becomes confused, unconscious, or is unable to swallow, don't give food or drink or anything by mouth. We don't want to make somebody choke or aspirate. This is when a medical emergency would be needed. So we would want to call 911 or ideally use an injectable source. So call 911, get them to a hospital or a clinic. As nurses, particularly at the bedside, we always emphasize low blood sugar should never be ignored. That is always an immediate action that we need to take. So then shifting to high blood sugar. High blood sugar usually develops more slowly, but it can still be serious if left untreated. Symptoms can include the increased thirst, frequent urination, fatigue, blurry vision. So again, first, if you're able to check the blood sugar, please do so. If it's elevated, you can drink water to stay hydrated and ideally kind of even out the level between the hydration and the sugar that is in your system. So this will help also flush out any excess sugar from your body. We want to avoid sugary foods and drinks until your levels improve, just to kind of naturally have those regulate and pull down and decrease. If you're prescribed insulin or medication, please take it as directed by your practitioner. Don't guess or double up on it just because your blood sugar is a little bit high. Take what is prescribed to you. And then get medical help if the blood sugar stays too high. If there's signs like nausea, vomiting, abdominal pain, fruity smelling breath, that means that the sugar is literally being excreted in your breath, or even rapid breathing, these can be warning signs of a medical emergency of blood sugar that is way too high that your body cannot regulate. So from a nursing perspective, the key message is persistent high blood sugar is not something to wait out. This needs follow-up. So my key takeaways for you, one of the biggest lessons is this: low blood sugar needs fast action. High blood sugar needs consistent management and medical guidance. Knowing the signs and what to do can help prevent serious complications. Understanding blood sugar is not about fear, it's just about awareness. Recognizing symptoms allows for quicker, safer responses. We want to emphasize balanced meals, consistent eating patterns, movement, sleep, stress, all of these things I always talk about. They play an important role in all of our health, but in blood sugar regulation for our topic today. And for those with diabetes, monitoring and individualized treatment plans are essential. As always, this content is for education and informational purposes only. I'm not substituting this or advising that you substitute this for guidance provided directly to you by your medical practitioner. So please follow that first. So today we talked about blood sugar basics, how to normally regulate, or rather how the body normally regulates, and then how to recognize signs of low and high blood sugar. So I hope this helped to clarify. If it did, please share it with somebody. Like and subscribe, leave a comment or email any questions that you may have. I will see you guys next week for our next topic. And as always, thanks for listening.